Hi, it's Austin from S2S here. Just going to do a quick demonstration video just to give you the real key messages about administering naloxone. So for you that don't know, naloxone's a medication that will reverse the effects of opiate or opioid overdose. So how do you know if someone's overdosed on opioids? Well, there's some key things that you can kind of look for. So if a person's not rousable, so often when people use opiates, they want to get to a point of gouging. And it's quite a fine line between gouging and being unconscious. So what you need to do is kind of, shake their shoulder, shout into their ear to try and rouse them. I'd suggest not rubbing the sternum, sometimes that's advised, but if a person's just asleep and you rub their sternum, they might wake up and be a little bit angry, so I'd advise against that. In terms of their breathing, it'll be shallow and infrequent, or potentially not breathing at all. There might be a bluing of the lips, tip of their nose and underneath the eyes. One of the other key things is looking to see their pupils. If they're pinpricked, that's a sign of opiate use, an opiate overdose. As well, you might have a bit of prior knowledge, so you might know that the person's an opiate user, you might have been using with them and they've gone over after they've injected. So what do you do? So the first thing you do, if you've identified someone's overdose, call an ambulance. Whether they're breathing or not, call an ambulance. If they are breathing, get them into the recovery position. There's lots of kind of materials out there to show you what this is. If they're not breathing, you need to get them on their back, and if you feel comfortable, perform CPR. Once you've called that ambulance, they'll be able to advise you on the steps to take and what you should do. So essentially it's 2 rescue breaths and 30 chest compressions. So if you're confident that the person has had an opioid overdose, you've either got them in a recovery position or start to perform CPR, and you've got a naloxone kit available, then you can administer it. So this is a kit. Comes in sealed packages, cellophane packages. Just need to take that off. Then to open the kits up, this is my demo kit here. Essentially it's a twist action, so it's not a straight open, so you just twist it like that. The last thing you want to do is in that crisis situation be struggling to kind of get in there, so that's worth bearing in mind. Then inside the kit there will be instructions in the new kit. This one doesn't have any, but there will be the preloaded syringe and 2 needles. Now the 2 needles, there are 2 just in case one gets dropped or contaminated. Just as you're trying to put it on, you shouldn't swap the needles because there's going to be risk of needle stick injury. So essentially to get the needle on, there'll be a cap over the end of the kit normally. You just open the bottom end, a bit fiddly. And if you think in the overdose situation, there's going to be a lot of adrenaline, so this will probably be even harder. So, then once you've got it on, and then essentially to get the cap off, twist it rather than just pull it, and that will reduce the risk of needle stick injury. Now once the needle's unsheathed, never try and resheath it, because if you think about trying to put a sheath back on top of there, the chance of needle stick injury is quite big. So you've got your casualty on the floor, either in recovery position if they're breathing or performing CPR. So do your first lot of CPR if they're not breathing. Then essentially you'll be ready to administer naloxone. So there's 2 areas where we can kind of inject it to. The upper arm muscle, which is known as the delt there, or the quad, which is the outside of the thigh there. Personally, I'd recommend the quad muscle or the thigh, just because it's a bigger area, it's easier to target, and if someone's got multiple layers of clothing on, think about winter time, they might have a couple of coats on, a hoodie, a jumper and a couple of t-shirts, whereas likelihood is they may have 2 pairs of bottoms on, a pair of jeans and jogging bottoms, and it's going to be easier to get through there, and also it's a bigger target to get into. So essentially the action is, it's like a dart action holding a pen, and you need to go in at 90 degrees. It's going to pierce through the clothing and there'll be a bit of resistance, and then the first layer of skin. Once you've got through that, it should go in relatively easily. Once it's in, just apply a small amount of pressure And be careful, because it's quite easy to push really hard and inject more than one of the increments. So if you see on the side there's 5 individual kind of doses, and just press down until the bottom of the plunger gets to the bottom of the first increment. Then take it out and replace it in the cradle. Then you need to wait for 2 to 3 minutes for it to take effect. If you're doing CPR, because the person's not breathing, you can do another round of CPR during that time. If the person starts to come back round, you don't need to kind of necessarily inject anymore. If they're still unconscious, then you'll do another round. And there's 5 increments in here, so you can do that 5 times. So if you're thinking about 2 to 3 minutes each time, after 15 minutes, an ambulance should be with you, because you've rung the ambulance straight away. So in terms of the medication itself, essentially it knocks the opiates off the receptors in the brain, and it will temporarily reverse the effects of overdose. However, it's got a very short half-life, so it only lasts for about 20 minutes, whereas some opiates have very, very long half-lives, especially things like methadone. So it's really important to stay with the casualty. They may wake up and be confused, and encourage them to stay and seek medical attention for when the ambulance arrives, because what will happen is potentially they may come out of the overdose but go back into it because the naloxone's worn off, but the opiates are still in their system. Hope this has kind of helped. Real whistle-stop tour of how to use a kit. There's plenty of other resources online. We'll add some of the links into the description below. Stay safe. Cheers.